Hi everyone, Dr. Keith Mirante here, and it's winter time, and I want to share with you an amazing tip to get through the winter injury-free. And so one of the most common injuries we see over the winter is low back issues, pain, and also herniations and bulges of the discs. And so what I want to do is I want to share with you why that happens, and then I also want to give you some tips for you to get through the winter without being affected by any of those. So first, I think we need to set the stage and so we can understand the anatomy of our spine first, and then we can go ahead and go into some tips. So the anatomy is, our spine is made up of multiple bones. And so this is the bone, and then between each bone is a disc, and the disc is actually a jelly-filled fluid. And that jelly is a sugar bound to a protein. And what that does is it acts like a sponge. And so that sponge has an affinity for water. And so that's why it's a jelly-like substance. And so on the inside of that disc space is a lot of the jelly part of it. And as you get to the perimeter, it's a collagen. It's a tougher, thicker substance. But what happens is, as we go ahead and we lie down horizontal and we sleep, each one of these disc spaces fill with fluid. And so therefore, these spaces fill with fluid. The space gets larger. Picture a full water balloon between two bones. And then as you go ahead and you get vertical, all of a sudden you start to compress that disc space and you start to squish fluid outside of the disc space. And so that's the reason why that you're told that most people are about a ½ an inch taller in the morning than in the evening. The reason is you lie down, all these 24 different spaces fill with fluid, they elongate, you wake up in the morning and you're taller because each one of these spaces has more fluid in them. The day goes on, you compress, gravity takes effect, pushes fluid out of the spaces. So therefore, when the fluid comes out of the spaces, instead of having a full water balloon between two bones, it's maybe a half-filled water balloon. So it's more flexible and more pliable. So here's where we get into trouble. In the morning, you go from lying, you look out the window, and there's snow. And so what happens, you rush outside, you go ahead, you start shoveling your snow, and what happens is you still have that full water balloon between two bones, so to speak. So this disc space is completely full, and there's a lot of pressure inside that disc. And then when you go ahead and shovel and you rotate your body, a full disc space with a rotation movement is a recipe for disaster, and that is the main reason why you will blow a disc in the middle of the winter. And so all of a sudden the pressure shoots out here, and now you start to bulge, and now that bulge now presses on a nerve, and that's what's going to get you into trouble. So let's go over a couple things that you can do to avoid this and how we can go ahead and make this a better, safer, healthier winter. So number one, what you want to do is you want to make sure you do not rush right outside from bed. You want to at least wait a little bit. And so during that time frame, what we want to do is we want to warm up the spine. The best way to do that, sit on this thing, go side to side, front to back, and then do rotation. Spend about 5 minutes on here. Get this disc space nice and pliable and nice and moldable. So when you go ahead and you do that rotation, it's not a full disc swelled with fluid anymore. It's actually pliable, it's warm, it's moldable. The next thing I'd like to see you do is spend a couple minutes getting your heart rate up, getting your body warm. Just like athletes prepare their body for a sporting event and stretch and do some things like that, I would like to see you do the same exact thing before you get outside and get shoveling. Last but not least, most important, is maintain your regular chiropractic adjustments. That's going to make sure that you do the best job that you can do, keeping these bones exactly where they're supposed to be, reducing subluxation, keeping pressure off those nerve roots, which is going to keep you healthy, keep you happy, and keep you whole. So this is Dr. Keith Mirante again, signing out. Have an awesome rest of the day, guys.